Again, welcome to our monthly functional weight loss discussion. We're going to be talking about solving weight loss resistance. It is something that we're probably all dealing with. And like I said, we really are excited to bring this presentation, or should I say discussion, to you, because hopefully we do have more engagement, because again, we only get better by, collaborating with each other. So I'm going to go ahead and get started here. So my name is Sherry Stoka. I'm here with Erica Gutierrez, and we are registered dietitians and functional nutritionists. And we're on a mission. We're pretty passionate about reshaping the future of weight management. We kind of feel like over the course of the years we've gotten off track with really being able to help people the way that they need to be helped. And dietitians are key players in this area. We are the ones that people are talking about as experts in weight loss, and we feel like we can do so much more. And when, we're presenting to people right now, there's going to be people out there that are all over the spectrum as far as their experience with weight loss. So that's why, if there's opportunities for questions and engagement, we really want to hear from you. But most people should know by now that we cannot, as dietitians, just focus on calories and meal planning and telling people to exercise more. We are in a different state of health. Weight loss resistance is real, right? It's ubiquitous, and it's multifactorial. That's why we've taken the approach of functional weight loss, because it's truly a game changer in helping people. Precision care and addressing underlying imbalances in the body is so important, because we have to move the patient along the spectrum. This is not something that's going to happen overnight, but we have to gain ground. But what we see over and over is that patients have spent years and years and years trying things, and then they end up exactly where they were. So we're here to really help change the way that we practice. So just a little bit about Weighless MD, a little bit about us, and why feel we are weight loss experts. So I opened Weighless MD in 2015. Weighless MD is a medical weight loss and wellness clinic. It is the only one owned by a registered dietitian nutritionist. So we obviously take a much different approach. Food is obviously the foundation. We understand food and nutrition really, really well. Over the years, we have created all of our own programs. I mean, we've tried many different things. We've done studies of our own, but we really got to know the patient and what the patient needed, because of how patients are presenting nowadays. It's not a healthy body anymore where you can do simple things. Like, it is a very complex, in most cases, scenario. We consider ourselves experts in functional weight loss and GLP medications. We manage about 20 to 30 GLP patients a day. And we also have created what we call strategic weight loss that we'll touch a little bit on. But we also, in our practice, we do a lot of different specialty testing that, again, we might introduce. But a lot of these things and the discussion that we have today is really just hitting the highlights, because we go into a lot of detail in the different courses that we've developed over the years. So the objectives for today, we are going to talk about how a typical patient presents. And we're all going to relate to this, because I do truly feel that it's kind of like you hear the same stories, and the patient will kind of always this kind of thinks that it's only happening to them. And I'm always like, well, no, this is very common. We're going to talk a little bit more about why calories and exercise doesn't work, what to do when patients stall, because it's real and it happens to everyone. And then we'll just look at like a clinical review of the whole picture. What is going on with that typical patient, and how can we address and help that patient move forward? A big piece to that is going to be assessing symptoms because symptoms can tell a big story. We'll talk about different nutrition approaches for common conditions. And at the end, we'll touch on the different things, courses that we offer for becoming a functional weight loss expert. Okay, so how a typical patient presents, the image to the right really kind of tells the perfect story versus my bullets, but they come in with digestive issues, lack of energy, excessive belly fat. They can't get rid of the belly fat. They're confused. They're told they've tried this program with this person and met a dietitian at the hospital and gained weight. So we hear so many different things, but it's all pretty similar. But patients are overfed and undernourished, right? Because of the standard American diet. That's what the standard American diet does to us. They're on multiple lifestyle medications because that's our approach in conventional medicine, that we just give a medication rather than really getting to the root of what could be causing certain things. They present with multiple symptoms. Their exposure to certain environmental toxins that are wreaking havoc in their system, that they're unbeknownst to, right? So things that, maybe you could, that's something that we can help you understand, like what other things can you be looking at? Not sleeping well, they're overstressed, and again, going back to the confusion of what to do. And it comes on so many levels and layers because of the media, but it also infiltrates in the professional organizations, the professional experts who are out there talking to people about what they should be eating for when they're obese or if they're diabetic. There's a huge disconnect that we're going to touch on today. All right, we are going to start with a poll.
So I have it launched. You can pick multiple of these. So what do you think is the cause of weight loss resistance? Poor diet, eating too much, eating too little, sleep and stress issues, comorbidities, processed food, sedentary lifestyle. I am seeing most people pick pretty much all of them as key components of it. Sleep and stress is winning for sure. Okay, so it looks like sleep and stress, number one, eating processed foods, number two, poor diet, number three.
Okay,
Thank you, everyone.
yeah. We kind of just wanted to get a gauge, and yeah, I mean, when you have it all in front of you, it just makes sense that they're all coming into play. So when you think about that, or even just answer that question, and you think about how you, if you are a dietitian or nutritionist and you're working with people to help them lose weight, if all of these things are contributing and we're just focusing on the diet, you can see that we really are missing some really important pieces. Okay, so another big piece to all of this is the obesity narrative that is everywhere. And what we're told and what we all are meant to believe is that obesity increases our risk of chronic disease. It increases our risk of high blood pressure, high cholesterol, higher heart attack, cancer, etc. And that's actually not true because obesity is not the cause of all of these issues. Obesity is a result or a symptom of all of these long-term metabolic issues. If you think about it, most people have not developed metabolic dysfunction overnight. They've had this brewing for 15 to 20 years, and they didn't get obese overnight. This has been a progression. You can imagine at 25, 30, you're put on your first medication, and then you start to develop gut issues, then you're getting migraines, you're put on a second medication. So this is a progression of the body starting to now adapt to altered metabolic processes. These metabolic processes are making it impossible to lose weight by, expecting this energy balance type of thing and energy expenditure. It doesn't work anymore. So this is a very, very important piece. And if you don't understand this piece, it's going to be really hard to help people lose weight. The body is out of balance, and this is just an example. In if you went to dietitian school, you were told that if you would just decrease your calories by 500 a day, you would lose 1 pound of fat in a week. So we do know actually that there are approximately 3,500 calories in 1 pound of fat. So if you extrapolate that into a number, this particular person that we do in bodies on people to look at everything when people are losing weight. So this particular person has 101 pounds of body fat. Okay, that is a lot of body fat. So if you multiply that by 3,500, you're going to get about, over 400,000 stored calories. So these are some of the things that just early on I would just ask. I'm like, why? Like our body is supposed to be smart, but yet we can't restrict calories and the body won't use these fat stores and rather it's going to muscle. Like this doesn't even make sense. So we'll kind of introduce like some certain topics to help you understand that. And the first piece is that we have different types of fat stores. And the visceral fat is the most resistant inflammatory fat in the human body, and it is very different than other fat cells like subcutaneous. We actually have some different type of fat cells called brown fat cells that are healthy. And again, we talk about this a lot in our course, but it's really important to understand that if somebody has a lot of visceral fat, the body won't go to that for energy because it's of the inflammatory nature of it, it cannot get into the mitochondria. And these cells need to get transported into the mitochondria so the body can use it for energy. But that does not happen. So then you have these fat cells sitting there, and now it becomes the dumping ground for all the processed fillers, additives, and things like that our body cannot get rid of. Our body was designed to do a lot of detox, but it was not designed to do this much. So it has to do something with all of those toxins coming in, and it literally gets pushed into the fatty tissue in the visceral. So this inflammatory state never gets the patient out of this metabolically imbalanced state. And just by putting them on a meal plan is really gonna do nothing. And the downhill spiral continues with their overall health. Most of us know that, working with patients who are obese, they have major gut issues. A good portion now have autoimmunity. So visceral fat produces its own inflammatory compounds. It completely changes the metabolism of lipids, and it completely changes the blood sugar regulation. So that's foundational to metabolic health. Inflammation that is supposed to be sporadic and there when you have an injury so that the immune system is triggered to come and heal. But now the body is inflamed all the time. And this is where autoimmunity starts to come into the picture because the immune cells are very confused. And that's why they start attacking their own tissue because inflammation is supposed to be in a specific area where there's an injury, but now the injury is all over. The gut becomes inflamed, it becomes leaky. Now that exacerbates insulin sensitivity, resulting in insulin resistance, huge correlations with leaky gut and type 2 diabetes. Again, everything that we say, there are studies that support all of it. The immune system, again, like I said, it's just people's immune system. I mean, people just you can, even your patients, I mean, how many times are they on antibiotics or sick? They have a sinus infection. During COVID, they got COVID 4 times. I mean, the immune system is suffering significantly. And this autoimmunity just continues the destruction. So if you don't know by now, and you should, especially if you're a dietitian, that our food is making us sick. The standard American diet, all you need to do is Google it, and you'll get a write-up of how it causes heart disease, cancer, diabetes, and autoimmune disease. The food additives, sugar preservatives, fillers, and dyes are causing our fat cells to become inflamed. And this is what is contributing to this resistance. The body cannot use those fat cells for energy. Seed oils have come to, be somewhat of a popular topic in, health, wellness, weight loss. And if you are not familiar with seed oils and you don't understand what the hype is, I really encourage you to read up on them because they really can cause a lot of damage in the body. And just to highlight what happens to these little seeds that are supposed to be healthy for us. But now what they're doing when they extract the oil from the seed, they are heating it to extremely, extremely high temperatures, which we know that damages it immediately because fats are not supposed to be heated at high temperatures. So then they take the oils, they process them with hexane, and then they have to deodorize it because the oils have become so rancid. And so then they add like bleaching agents to it so it, improves like the smell. And then they add more chemicals to it to improve the color. So those are the seed oils that are available in mostly all of our foods now. If you see like the soybean, the sunflower, the safflower, the corn, all of those seed oils. So food is not real anymore. And big business plays a big piece to all of this because of, the funding and the junk food companies. I mean, the American Academy of Nutrition, I was just, I was very, very involved with them and still have a lot to do with all of that. But, they are funded by a lot of the junk food industries. And so you can imagine that there's going to be some mismessaging being relayed because you can't if you're being supported by somebody you kind of have to stick with the with the proper verbiage to support that. So that's just something to be aware of. And all of the associations, this is not just the Academy. I mean, it's the American Heart Association, the Pediatric Association, the Diabetes Association. All the sponsorships are involved in that. All right, so here's our next poll. This is in our nutrition care plan.
This one might take you a minute to fill out because this is also multiple choice. So there can be several answers you choose. But as you can see, just take a look at that meal plan and then decide. There's some different things on macros, adding snacks, reducing snacks, lower calorie, more fruits and vegetables. So pick what makes sense to you. We'll wait a minute. This will take a little minute. I know if I was looking at this, I'd be like, I want to see the labs. I want to see what their weight is. I want more information, but just going off of someone having what you would know is they're currently not able to reduce their weight and they're trying.
Well, this is for somebody with diabetes. This is a meal plan for somebody with diabetes.
This is yes. Yeah.
Yeah. So that's kind of telling in itself. Okay.
I'm sure you didn't know you had to put this much work into this session today. So I'll give you a synopsis of what is here. It looks like the majority of people said that this meal should be higher protein. We had a few say that it should be lower carb. A few say more fruits and vegetables. A few say no snacks. And then a few also say it's well balanced and appropriate.
Okay.
Okay, great.
And this could be, you know, a longer discussion. So, if you kind of think about, I'll try to be somewhat politically correct, but if you think about a person who has diabetes, a person who has diabetes has a carbohydrate intolerance. They don't process sugars. And so we're giving a person, it's like giving a lactose intolerant person dairy all day. Okay, so we should not be giving this many carbs and sugar to somebody who doesn't tolerate it. This is an example of managing a chronic disease versus reversing it. And so that is what we do with our patients. We don't want to keep them where they're at. We want to dig deeper and get them out of that state of just chronic metabolic dysfunction. Um, this is such an important piece when you're working with patients because there are many lifestyle medications. I bolded the main ones that we see all the time that are contributing to weight loss resistance. And again, I go into more detail in our course, but we touched on them. But antidepressants, synthetic hormones, antihistamines, beta blockers, sleep aids, steroids are big, big. I mean, they cause a lot of insulin blood sugar issues, amongst other things. So it's something to consider when you're really stuck with somebody. You have to go back and look at what medications they're on. And then their environment. I can't tell you how many times I am working with somebody and we're big into mold. We just are, and we don't expect people to like all of a sudden become big into like mold like us. But it's just when you hear little things, over time, it's gonna stick with you. But it is something that really affects people's health and their ability to lose weight. And oftentimes people don't realize that they either have mold in their body or they're breathing and living in mold in their home. So again, that comes with many detrimental effects. The pesticides are everywhere, everywhere. We consume them on a regular basis. We all should know about the microplastics and the plastics that we're exposed to. The pollution right now, I don't know where you guys are from, but I'm in Wisconsin right now and we're getting actually hit by the fires in Canada, and this is like the second time. So it's not going to affect us as much, but that's going to be a burden on a lot of bodies, and we have to be able to kind of react and adjust to that as well. And then just our tap water contamination. The liver and the gallbladder, most people don't have gallbladders now, but which is sad, but the liver has taken a real burden, and that is the main organ that is keeping our body clean. Obesogens are, again, something that you can research. There are a zillion studies on obesogens. These are chemical compounds that affect normal development and the function of lipid metabolism and our endocrine system. So they alter fat storage, they alter our set points, our weight set points, they disrupt the energy balance of the body. They modify our appetite regulation, they overburden the liver, and they pollute our body. So again, obesogens are ubiquitous. They are found in almost everywhere. I mean, our clothing, our laundry detergent, our air fresheners. I mean, they're everywhere. So here are just some signs that your patients might just be toxic overloaded. They're dealing with allergies, acne, anemia. They have autoimmune disorders. I mean, that autoimmune is a gut issue. Hopefully, people kind of tie that together. Chemical sensitivities is a huge sign, meaning like the body's bucket is overflowing. The liver can't keep up, so they feel sick when they're in certain environments. Bad breath, gallstones, headaches, itching, brain fog, forgetfulness, fatigue, and so now they can't lose weight.
All right.
All
I am
right.
going to take over here, and I'm really hoping in the next 15, 20 minutes, I don't overwhelm you too much. I'm trying to give you some simple things you can walk away with today, but realize it is complex and there is a whole system to making this happen. So I put together this image, and I know it's kind of small, but it'll just give you an idea of some different pillars that we need to be looking at. Yes, of course, nutrition. Yes, movement, but also gut optimization, hormonal optimization. We do need to look at mental well-being and those lifestyle behaviors. So if you haven't looked at your intake form in a while, it's definitely worth revisiting. I feel like I go back to it. If I go through a session with somebody and I'm asking the same question, that's something I'll add to that intake form because it just saves so much time for us. But we can be extremely thorough. And I would highly suggest asking things in different ways. So if you ask a patient if they're constipated, they might not even know what constipation is. So it's about asking directly, how many bowel movements do you have in a day, in a week, so that you get an accurate picture. So really finessing that and going back and changing that is crucial. I'm going to talk about our symptom assessment and how this really can give so many clues. And it's not about one symptom, it's about looking at all the symptoms as a whole to gauge that picture. Labs are amazing. They're early warning signs. I can't tell you how many times we ask for labs and the patient's like, oh, all my labs were normal. But when you really look at labs in an optimal way, it's a game changer for helping somebody be proactive versus reactive. Almost everybody sits right around 30 for vitamin D, and we know that's not an optimal range. So we love taking a peek at their labs. Anybody that has metabolic dysfunction has some sort of a gut issue. I feel really strongly about that. Um, they might not present like they have gut issues. They might have a bowel movement every day. They might not have reflux, but if you do some testing or even just try to optimize with digestive enzymes or probiotics or something like that, you see shifts and improvements there. Trying to hone in on those lifestyle factors that could be exposing them to toxins. Think about how much water we drink in a day. What is your water source? Think about the air we breathe. Is it clean air? Do they need some sort of air filtration? The medications Sherry touched on, sometimes they deplete nutrients. So we need to really factor in the nutrients for that. And then people are on supplements and they don't even remember why they're on these supplements, or they're expired, or they're on too many. So really looking at that is important too. And then we know that inadequate sleep and high stress lead to further metabolic dysfunction, but that can't be the place you start. We'll be chasing ourselves, trying to change this and that. We have to first get to the root of the issues. Okay, so I love this topic, expanding your lab knowledge. And I'm going to it's actually a patient I had this morning. These labs at the bottom right here were the extended labs we did. And it is so telling, and a regular lab panel wouldn't have shown this. So most providers will screen for TSH and they'll stop there. If you look down at her thyroid panel, you can see T4 is extremely elevated and reverse T3 is low. They don't test for the autoantibodies, and that is a huge difference between, is this autoimmune related thyroid issue or just a thyroid issue? So we have to look at that whole picture. There's so much nutrition that goes into thyroid for the conversion pieces, and that can be a whole topic on its own. So not just fasting glucose. Someone can have a normal fasting glucose, but have insulin resistant, have A1C be off. Now, this patient specifically, you can see the fasting glucose was normal, the A1C was normal, but the glycated serum protein was high. So it's a different angle or way to look at dysfunction in glucose levels in the endocrine system. Not just ferritin. Look at this patient's levels of iron, almost double the amount of what is recommended. So iron overload for sure. But if we just did that ferritin, that check, we wouldn't be able to see what's actually going on. So I hope this is a way to show you like these more extensive labs are very helpful. When we think about weight management, some of the other things to consider would be cortisol. Is it always high cortisol? Is it low cortisol? And then testing hormones. Most testing will be done on just the morning cortisol, and it is helpful, but not everybody not everybody's morning cortisol is the problem. Sometimes it's their cortisol awakening response. Sometimes it's later in the night that they have high cortisol. So we have to look at the actual cycle of what's happening there. And this one's a personal one for me. My daughter had her hormones tested, and the endocrinologist did it at a random time of day, a random time of month, and expected to create a diagnosis off of this. And it showed nothing. And they're like, no, nothing's wrong. So then I went back and did my own testing with a 24-hour urine saliva collection. And sure enough, major dysfunction in the body. So there are just such better tests at actually being accurate of what is going on with health. Not just lipids. Sherry has done several presentations and they're on YouTube where you can look at this. And I think it's really come to light lately that just total cholesterol, LDL, HDL isn't going to be enough. We actually have to see if that LDL is harmful, if the HDL is being supportive and helpful. I can't tell you how many times I see cholesterol go skyrocket just acutely when there's an inflammatory response going on, and it has nothing to do with their overall heart health or their diet. So that's something to look at. You know, we always get sodium, potassium chloride for the electrolytes, very important, but what about the B vitamins? What about magnesium? What about vitamin D? Most of us are deficient in vitamin D, and very important, as you all know. And so I'm sure with those, there's no question on wanting those labs. But then there's some other things you can look at, leptin levels, adiponectin, and their antioxidant status. All of these things tell stories about what potentially is causing dysfunction, metabolic dysfunction specifically. Okay. So you can see on the right, this is just one little piece of what we have for our symptom assessment form. And we send symptoms out regularly, of course, when we first start working with them, but then as we manage them, we want to see that symptoms change. I have a little bit of a cheat sheet on there where you can see what we've, if you have certain conditions or presentations, what potentially it could be, because we need to look at that whole picture. So in the nutrition world, we can get specialty training on that physical presentation and how it shows up as nutrient deficiencies. So we look at hair, nails, tongue, skin for different vitamin deficiencies, thyroid issues, food sensitivities can show up here too. Some of the physical symptoms I really am looking for in the eyes, ears, nose, throat would be those allergies or histamine responses. When someone has gut impermeability, we have a mismatch in our histamine response or the amount of histamines that are produced. And it can really cause a burden on the body, on the liver specifically, which needs to detoxify histamines. And when that builds up, it's inflammation in the body. When the body doesn't feel safe, when it's overloaded, it will not lose weight. And the same goes for those environmental exposures. Mold is extremely nasty in this way, and it just creates that extra burden on the body. Neurological can be it can go in a lot of different directions, but what I'm talking about is the brain fog, anxiety, dizziness, balance. And, this something to look at would be the neurotransmitters and amino acids, making sure that they're getting the adequate intake and that they're converting properly. There could be blood-brain barrier issues, blood sugar imbalances, inflammation shows up here, the mold, and heavy metals is a really big one in this category. So for people that have the amalgam fillings, what Sherry was talking about before is that anytime the body has a toxin and it's too much of a burden for it to excrete, it gets stored in places. And one of the favorite places for heavy metals to get stored is in the brain. And then that can lead to a lot of the different neurological issues. Changes in energy, sleep, weight, and their sickness frequency. This is an important question to ask because, this always makes me think of cellular health. It makes me think of hormones, definitely nutrient deficiencies. When people are trying to lose weight, they often are restricting in some way. So even by sharing that meal plan earlier, we are by no means saying we want a very restrictive diet. In the short term or in certain situations, yes, we have to be very diligent and careful, but the whole idea is to be able to expand, for gut health, we need to expand our diet. For these nutrients, we need to expand. So by no means are we saying that, but it is really important to create awareness for these patients. Here, environmental exposures show up again. And then for the GI symptoms, constipation, diarrhea, stomach issues, burping or reflux. And here is where I would look at how is their digestive function? How is their microbiome? Have they been on a lot of antibiotics or have they been on NSAIDs regularly? Because that depletes the microbiome. And then the intestinal permeability piece. Okay, so there is a lot on these slides, or on this slide specifically, but what I wanted to try to give you was a general idea of approaches that we take to common conditions. So we get that woman in her 40s, 50s, 60s transitioning to menopause. What do we do with them to help them? Because they're the ones that have cut back in their diet so much, they're not eating enough food and they still can't lose weight. We want to really optimize the hormones that they do have. Phytoestrogens are really helpful, making sure that they have adequate intake of nutrients for their bone health, that they're getting the resistance training. Anti-inflammatory is really important. As we age, we have a higher demand for antioxidants. So more anti-inflammatory would definitely benefit them. Hydration and fiber rich. I don't think I have to talk to this population about fiber rich either, but so crucial to make sure and actually tracking for a while to see that they're getting those optimal levels. And here I like to use adaptogenic herbs. You could have some hormone replacement therapy through a provider. Omegas are really important for gut and hormones and pretty much everything, reducing inflammation. The B vitamins, and like I said, that you can even supplement with antioxidants. Now, someone that has insulin resistance, and a menopausal woman could have insulin resistance too, but if you put them in the bucket of insulin resistant, this is where the meal plan with 3 to 4 servings of carbohydrate at a meal is just not going to work for them. What's going to happen is their blood sugars are going to rise, their insulin level needs are going to go up, insulin signals to store fat. It's a bad situation. So we want to get lower glycemic. We want that window of the blood sugars to be really nice and tight. High fiber helps a lot here. Those healthy fats, lean proteins. Definitely limit sugar and processed foods in this group. I like berberine, alpha lipoic acid, chromium, inositol. Some supplement companies will have them all in one. And I would really suggest looking at gut health for this. Liver function is a really big one for insulin resistance. All of that plays a crucial piece. Then you have the toxic overloaded person. They probably have had, the really poor diet exposure to all different things. They need support with detoxification. Cruciferous vegetables are hands down like the best way through food to improve this. There are pieces within the cruciferous vegetables that in phase 1 and phase 2 of detoxification support the process. So sometimes what happens with people, especially with certain like nutrient deficiencies or even genetics, they get caught up in phase 1 or phase 2. And we really have to make sure it pushes all the way through, because if it gets stuck between phase 1 and phase 2, it's actually higher oxidative stress than the original product. So it's so crucial to make sure we're getting all the way through. Sulfur-rich foods are important. A lot of people don't have enough of those, the garlic, the onions, and some people can't because they have digestive issues and those things cause them distress. Hydration, again, is really huge. And the best thing you can do is reduce their exposure. So start cleaning things up, reduce their plastics, make sure that the water and the air, all that stuff, they just slowly start decreasing. And the clean diet's really important here. Sometimes we need to add support. Milk thistle's really good, NAC or glutathione. Sometimes we actually do need binders like charcoal clay, chlorella. And of course, here I would look at gut health. And the fourth one I have here is the immune autoimmune. This is the person that, first starts out or presents with Hashimoto's, for example. Then they start to have the pain issues, and it just keeps layering on. These people would benefit for a period of time to bring down that inflammation, an AIP diet, or I would argue a food sensitivity test, to the MRT. Omegas are really helpful here, antioxidants, finding what those food triggers are and removing them. It just can calm and soothe the immune system. And some other things that you can do supplement wise would be vitamin D, vitamin C, zinc, turmeric, ginger, resveratrol, extra B vitamins. When the body is in this autoimmune state, it is in a very stressed state. So just like mental stress, the need for antioxidants and B vitamins are huge. Okay, so when we work with someone, there are times when a patient stalls or they come to us after they've tried all the things and they're stalling. So I hope this gives a little bit of an image for you. These up at the top with a tree, these are factors that we look for in weight management. So sometimes they're doing like 4 or 5 of them right, but they're missing 1 or 2 crucial pieces. And if the top half isn't like in balance, we start to see those root issues. And that's when digestion or food sensitivities or the genetics, those SNPs are turned on. So we look to resolve and heal those root imbalances, and then weight management or weight loss becomes much easier. We do offer programs. We have a total gut reset. We have some different strategic programs that we utilize that get to that resistant inflammatory visceral fat. And then we have a course out there for weight loss providers for the GLPs, and to help with guiding them through starting ongoing issues, side effects, and transitioning them off. Because the goal with us for everybody is to get them to a better metabolic state so they don't have to be on any of these medications. And when necessary, we will dig deeper into the specialty testing. So there are urine tests, stool tests, blood tests that we utilize when appropriate.